Hi, my name is Luz and I'm a paramedic at Jamaica Hospital.
And my name is Venus and I'm an EMT at Jamaica Hospital as well. And today we just wanted to talk to you guys a little bit about what to do if you ever find yourself in a situation where somebody is choking. Choking is the fourth leading cause of unintentional death in the United States, so knowing what to do in that kind of situation is very helpful.
So what happens when someone is choking? Normally, there is a foreign body object obstructing the airway. A foreign body in the airway will prevent a person to effectively breathe, which will eventually cause the person to go unconscious. The best way to remove the foreign body is to perform the Heimlich maneuver.
So the signs that you see when somebody is choking is that you would oftentimes see coughing. If somebody is coughing, you want to encourage that coughing. However, if you don't see any coughing, if you don't see any breathing, and if you don't see them speaking, that's usually indicative of a complete airway obstruction, and in that case, you need to perform the Heimlich maneuver. In addition to those signs, you're also going to be seeing the universal sign of choking, and that's usually when a choking person puts their hands around their throat like that. Now I just wanted to introduce my colleague Navi, who's going to perform the Heimlich and show how it's done.
Hi, are you choking? Do you need help? I'm going to come behind you and help assist you, okay?
So notice the first thing that Navi does is that he puts his leg in between the choking person's legs, and that's just to support her if she does go unconscious. Next, what you want to do is that you want to find the belly button landmark. After you find that belly button landmark, you're going to take your other hand and you're going to form a fist. Once you form that fist, thumb side in, you're going to place it right above the belly button. You're going to take your other hand and place it on top of that fist. So next you want to thrust in and upwards, in and upwards. And those are the basic steps of the Heimlich maneuver to dislodge an obstruction.
Always remember that after the obstruction has been dislodged, to seek medical attention. We hope this video was very helpful and thank you for watching.